when we talk about biological dentistry, it's just as we have functional medicine, there's also functional dentistry. This is gateway to your health or disease. Your health, this is your immunity, your hormones, your mood, your mental health. It all starts in the gut. And this is the beginning of the gut. 20 to 30 feet tube starts in the mouth. So everything we see in the mouth is a snapshot of what's going on down there. In other words, if we see a lot of inflammation in the gums, we know the gut is not happy. We know microbiome. Have you heard of a term microbiome? It's something we're coexisting with. So before we had this in medicine and in dentistry, we had this concept, we have to kill the bugs, kill the bugs, kill the bugs. Now we say, not really, we have to coexist. So there are bad bugs we try to get rid of, but for the most part, we need good bugs. And it's not just bacteria, it's also, we're talking about parasites, we're talking about fungi. It's really this beautiful world of different species that help us. As a matter of fact, they do. If I will look in the mouth and I will say, you know, your body wants to heal, it's always the case. All we have to do, just remove obstacles. What do these obstacles look like? Gum disease, any type of infections in the jawline. How do we diagnose those infections? We need to go further than just regular dental x-rays. And the easiest way to visualize it, think of a teeth of a three-dimensional objects, right? When you take regular dental x-rays, you're missing a dimension. So that's why I'm a big advocate of getting what's called CBCT or cone beam scan to actually see everything, the whole head, the joints, maxillary sinuses, nasal passages, can you breathe through your nose? Evaluating airway. This is something that really, really big, especially of those of you who are on the journey, which is all of you, right? We all are on the journeys to overall health, overall happiness, whatever you call it. If you're on this journey, you need to make sure you have enough oxygen. You probably have heard that. Oxygenation, oxygenation, oxygenation. Well, during the night, the only way for us to get this oxygen, making sure the airway, the air tube is open. How do we see those things on x-rays, on this cone beam x-rays, the 3D? Now, what else we'll look for? Well, airway, let me go down for a second. So any disease dysfunction in the body can be boiled down to two major factors. Not enough oxygen, what we call hypoxia, everything from leaky gut to psoriasis, eczema, chronically fermenting cells, you name it. Not enough oxygen, body's starving. And many times I have, by the way, a lot of young people in my practice, 20s and 30s, and they'll say, well, I'm okay, and we do the evaluation. Well, you know, your body is starving for oxygen. We're compensating. When we're young, in their 20s and 30s and 40s, we're compensating. We don't feel it. And then after 50, 60, this is where some people will be saying, oh, I was diagnosed with sleep apnea. Well, sleep apnea, when your body says, I can't, I'm very close to get a stroke or heart attack, I need to take this breath. So your body will wake you up in the middle of the night, and people say, well, I need to go to pee. Well, it's more than that. It's more than that. Our body is very, very smart. If it needs oxygen, it will wake you up as many times as it needs to. For you to take a deeper breath. This is really, really important. This is all about breath work, meditation, nervous system regulation. It all starts with the breathing. And this is what we are in dental world and in our medical world. We are what we call synergistic. We help each other. So if you don't have enough oxygen, well, maybe ozone treatments will be beneficial for you, right? But if we're looking about the root cause, and that's what biological dentistry is all about, why you have this narrow passage? Is there a lot of inflammation, mucus? Is it anatomy? So is it very narrow arches? Well, maybe we can look into expansion, or maybe someone is not open to expansion. Well, looking into things like CPAP, maybe you've heard it's a mask, it's a just continuous pressure of oxygen. It has its place. Is it something I recommend for the rest of your life? No, but definitely get you out of this dysfunction, and then on maintenance, we can look into other things that can help you. This is a big part. And then going back to conversation, so not enough oxygen, one big factor. What is the second one? pH, acidity. This is why we love how babies smell. They're alkaline. Now imagine the smell when you get in the nursing homes. What do you smell? It's usually not pleasant. Acidity. So it's really interesting how all those things can be picked up at your dental exam. We can check your pH. If I see someone who's very acidic, what would be the reasons? Well, one of the reasons, inflammation. Any type of inflammation, it means there is an abscess formation. There is some bugs, and a part of their metabolism is acid. So, in other words, as a dentist, I don't just look for cavities. Cavities is a result of acidity. But acidity by itself brings so much dysfunction to the body, the cavity is just part of it. So if I have someone, doesn't matter how old they are, they're coming in, they eat clean, a clean lifestyle, and they keep on getting cavities, my first question is, what's going on with your body? Let's go for the whole checkup. There's some acidity, there's some inflammation, there's something going on. What is another part that adding to this acidity? Our stress level. And you probably hear it a lot. Stress. What is it about? When we're stressed, our body doesn't know. Is it because my husband is getting me, or am I actually running away from a tiger, right? So it goes into sympathetic mode, which is, okay, we need to get ready. We have a lot of cortisol, adrenaline, dripping in our bloodstream in our body. And what body does, and we go into this acidic mode right away. So all of you take a deep breath and don't stress. Why? Because when we go into this acidity mode, it's not good for any one of us, but especially on those of us on the journey to their health. What happens? Again, bodies are very wise. They'll try to put minerals from your jaws, your bones, your teeth, to counteract the acidity. Do you guys know what pH, when I talk about acidity, alkalinity, do you know what I mean? So pH 7 is neutral. Above 7 is alkalinity, alkaline environment. Less than 7 is acidic. It's all about electron flow. So if I give you something, I become acidic and you become more alkaline. It's just a gift, right? So in the same manner, we need donors for ions, for electrons. So that will be minerals. So you lose minerals in your bones and in your teeth. But more importantly, when you're constantly acidic, it really creates this environment that's not very conducive to health in general. We want to be alkaline, we want to be full of oxygen. That will stop all dysfunction in the body, in the mouth, in the body.